AARP backs bill to stop Medicare Advantage upcoding. What it means for seniors. A shocking practice is driving Medicare costs sky high. AARP has voiced strong support for a bipartisan bill aimed at stopping upcoding in Medicare Advantage, a scheme where healthcare providers use inaccurate codes to secure higher reimbursements. If you're new to this topic, imagine a system where simple coding errors or intentional tweaks could cost seniors billions more. This is the heart of the controversy. In a detailed endorsement letter sent on July 14th to Senators Bill Cassidy, R. Law, and Jeff Merkley, D. or A, AARP warned that upcoding is likely to hike costs for Medicare Advantage enrollees by an estimated $40 billion this year. In the letter, Bill Sweeney, AARP's Senior Vice President for Government Affairs, underscored that while many Medicare beneficiaries enjoy the flexibility of Medicare Advantage, the misuse of billing codes not only leads to bloated payments to insurance plans, but also eventually results in steeper premiums for American seniors. But here's where it gets controversial. The proposed legislation, known as the No UPCODE Act, was introduced earlier this year by Senators Cassidy and Merkley. This bill seeks to change the game by adopting a new risk adjustment model that uses 2 full years of diagnostic data as opposed to the currently used 1 year. It also aims to reduce the impact of unrelated medical conditions when estimating the costs of care, thus helping to equalize the method for evaluating patients between Medicare Advantage and traditional Medicare. AARP argues that the resources wasted through upcoding could be better used to strengthen the core benefits of Medicare. For example, those funds could help expand essential services such as dental, hearing, and vision coverage, which are critical to the well-being of seniors. Senator Cassidy reinforced this point in a statement by emphasizing when companies upcode, taxpayers end up paying and patients see no benefit. That's simply unacceptable. His remarks spotlight a significant concern shared across party lines. The practice is not just administrative error, but a form of fraud that wastes valuable public money. It's interesting to note, however, that while the upcoding debate rages on, research from organizations like KFF indicates that 94.4% of Medicare Advantage payments are made properly. In fiscal year 2024, improper payments totaled $52.3 billion overall, a figure that, while notable, represents a relatively small percentage of total payments. This raises the question, is the problem big enough to justify sweeping regulatory changes? And this is the part most people miss. The Trump administration famously denounced waste, fraud, and abuse in Medicare and Medicaid, yet most payments are processed correctly. This bill, therefore, not only targets a specific area of fraud, but also encourages the deeper look into how even minor misreporting can have a considerable cumulative impact on the healthcare system. What do you think? Is the No UPCODE Act a necessary step toward protecting taxpayers and seniors? Or could such regulatory measures have unintended consequences for healthcare providers? Share your insights and join the conversation. Let's explore whether this approach strikes the right balance between accountability and efficiency. Enhancing Medicare Advantage. Lessons, insights, and future opportunities. In recent years, Medicare Advantage MA enrollment has skyrocketed, presenting Congress with a golden opportunity to refine and enhance the program, particularly for those in rural areas. With over half of Medicare beneficiaries opting for MA plans, it's clear that this program has been a game changer, offering lower costs and a broader range of benefits compared to traditional Medicare. However, as we delve deeper, it becomes apparent that there's a pressing need for greater scrutiny and transparency to ensure the program's integrity. While MA's popularity continues to soar, questions about potential abuses, such as inflated patient sickness levels to secure higher reimbursements, have surfaced. Lawmakers are grappling with these concerns, seeking ways to protect both beneficiaries and taxpayers. The conversation is not just about avoiding pitfalls, but also about embracing the program's potential to improve health outcomes through prevention and customization of care. Witnesses at a recent hearing highlighted the need for multi-year enrollment options to incentivize investments in preventive health and continuity of care. However, the discussion also touches on controversial topics, such as excessive prior authorizations that can harm access to care, particularly in rural areas. The balance between utilization management and quality care is a delicate one, with the potential to either facilitate or hinder patient access. As we consider the future of MA, it's crucial to acknowledge the challenges facing private practice and the need for reforms that could empower small-scale, personalized care delivery. The debate is far from settled, and we invite our readers to share their thoughts on these issues in the comments. And this is the part most people miss. How do we ensure that the MA program continues to deliver on its promises without compromising on fiscal responsibility or patient access? The conversation continues, and we're eager to hear your perspective.